are now arguing that they made our healthcare more expensive for our own good, folks. Just watch this.
You need to have a system that does both, takes care of you when you're ill and you're sick, but also incentivizes you to adopt healthy behaviors that keep you healthier and keep you out of the hospital. When there is a copay and a deductible, there's some skin in the game. Patients don't overutilize, and they're more likely to adopt healthy behaviors.
If y'all don't hear from me in the next...
That's some serious gaslighting right there. They think all Americans are that stupid to believe that? Oh, she's the stupid one. She thinks we're all stupid.
next 24 hours, someone should start a bail fund, because this single clip is going to turn me into the actual Joker. Also, for legal purposes, so the FBI doesn't show up at my front door, that was a joke, you nerds. Because not only is that patronizing as to essentially suggest that Congress's job is to make life harder for Americans because that will somehow make us more responsible as individuals, it's also just straight up not true. We know this because countless studies have already documented what happens when people lose access to health insurance or the cost of healthcare goes up. You want to know what people do, Marionette? They fucking die! Or, to back up a little bit, first, they just stop going to the doctor at all. In fact, about 1 in 3 insured adults and 3 out of every 4 uninsured adults say that they have delayed or skipped needed medical care entirely because of cost. Higher out-of-pocket costs are associated with underutilization of essential care, reduced treatment adherence, and as a result, more emergency room visits. In other words, creating financial barriers, you know, the very thing that Marionette was expecting us to thank her and her party for doing, do the exact opposite of what she is claiming. She's suggesting that people paying higher deductibles and copays will make folks feel like they have some skin in the game and therefore will take better care of themselves. And just pause for a moment and really think about what she is claiming here. To believe that that is even remotely possible, you would first have to believe that Americans are only sick because we just can't be bothered to take care of ourselves. Not to mention, what the does it even mean to suggest that people need a little skin in the game on this? I cannot think of anything more skin in the game than your literal skin. Your entire being. We're talking about healthcare, Marionette. People's literal lives. Do you not think that Americans have a vested interest in our own ability to stay alive? On top of that, if having healthcare cost us money out of pocket had any positive impact on people's health or health behaviors, we would already be the healthiest nation in the developed world. But in reality, we consistently rank among the sickest nations in the world, while our healthcare spending vastly exceeds what other countries are spending. But, you know, by all means, if Marionette and her party want to roll into the midterms telling Americans that we should thank them for their service of making our healthcare worse and more expensive, go right ahead, sweetheart. But don't say that we didn't warn you. Just like we've warned you for years about what taking a wrecking ball to our healthcare system would actually look like.
Americans have no idea what they're missing out on with the free healthcare system.
Oh, we know. Trust me, some of us travel, so we know what we're missing out on. Every time I'm there, I'm just nervous. I'm like, man, I just hope I stay healthy as much as I can. I try and avoid taking chances, any risks. I take more risk when I leave the United States because I know the healthcare outside of the United States is great. So people are starting to catch on, thanks to social media, thanks to people sharing information.
I lost a bottle of my HIV medication while on a trip because I've been hostel hopping and I just left it in one of the rooms. I told them that I lost it. Immediately they gave me another bottle, no questions asked. And they're just like, here, have a good day. I was like, oh. Because in the US, it's $3,000 a month if you don't have insurance, and it's still like $300 or $400 a month, even if you have insurance. It's just like a high deductible or something. But in Italy, it's free. You just walk in. You don't have to worry about dying or anything. And it just makes me think of all the people in the US who literally just can't afford medication, and they're either passing on HIV to other people because it's not like people are gonna stop having sex just because they can't afford the medication.
This is what's happening in cities like Houston, Atlanta. The HIV epidemic in those cities is out of control. People would rather take chances than go get treatment. It's really sad.
Or they just end up dying because HIV then progresses to AIDS without the medication. And I know the US has programs to help with stuff like that, like the Ryan White Foundation, but damn, having HIV in the US has made me rethink my career paths just to make sure that I'm going to be able to afford my medication and stay alive for the rest of my life. I wonder how different my life would be if I didn't have to worry about the cost of my HIV medication.
You did more for me.
You're better off being in Africa if you get HIV. It's really sad. Because at least over here, the medication is now going to be crazy expensive.
I'm just leaving Henderson Hospital, where I had to come in January to the emergency room when I had a 4-day-long migraine. I stayed here for about 4 hours, where you don't even get a room. They put wires in your arm, and then you go to the lobby and sit there with wires hanging out of your arm. And then they billed me $58,000, and I came to discuss my bill with the billing department. And they don't have a billing department at the hospital. This terrifying building, no billing department, and everything has to be done online, and they don't know, the people who work here don't know if there's a number that I can call to talk about it. So we're fucked.
58 grand for 4 hours. Like, if that's not a scam, then what is it, guys? The whole system is done. It's cooked. Just because the system is scamming, you don't have to do this. And here's the other thing. The wealthy clients, they understand that the system is a scam now. So if you go out on your own, you start your own home care business, and you service those wealthy clients, you're not scamming. You'll get the work because they're looking for people that are not scamming.
How much does it cost to go to the emergency room in the greatest country in the world? Especially for someone who has pretty good insurance and has already met their deductible for the year. Should be smooth sailing, right? Well, let's consult the bill. Now for context, I went to the emergency room because I was feeling extremely bad and they told me that nothing was wrong. But just to clarify, I got zero help. They did run blood work and they did do an echocardiogram, but there was nothing wrong with me and I was perfectly fine. Spoiler, I was not perfectly fine. So back to the bill. If I didn't have insurance, that little trip would have cost me $6,159.88. But like I said, you have pretty good insurance and you've already met your deductible for the year. So you probably barely paid anything, right? Nope. Somehow, your total is still $542.36 to be sent home. And if you thought that was it, you would be wrong because you also have to pay the doctor. Yes, that's right. Nowadays, you get 2 bills. One bill to pay the hospital and another bill to pay the doctor because God forbid they all work together. In your second bill, you learn that you also owe the doctor before insurance $1,286, after insurance $51.41. In total, you were on the hook for, I'm trying to do this math in my head, $593.77. Nearly $600 to be given no help and sent away. And this is with your good fancy insurance. God forbid you have anything worse or are uninsured. Greatest country in the world, my ass.
What a scam. So it looks like the doctors there are charging separately. They're billing separately now. Oh, okay. Anyway, if you're a caregiver, if you're a nurse, here's the deal. If you are working for any of these facilities, just know you're getting scammed too. You're getting scammed, so what's the point? You might as well go out on your own, start looking for clients on your own, billing clients on your own, privately, because Medicare and Medicaid is not working anymore. The government is broke. The United States government is insolvent. That means they're bankrupt. That means there's no money. Finito. So you might as well go private pay, and I can teach you how. I can teach you how to get these wealthy clients. I can teach you how to do sales, because you need to learn how to convince these wealthy clients to do business with you. But it starts by you investing in yourself. I'll put a link in the description of this video. Schedule a call. Let's talk about it. And I'll also add you to my private WhatsApp groups, depending on what state you're in, so we can hold each other accountable to do the work. Okay? Invest in yourself. Schedule a call. Talk to you soon.